Thank you for attending this breakout session. This session is filled with powerful information to help improve your health and empower you. Radio Free 102.3 KJLH. We are you.
Hello, my name is Dale Washington. I am a senior sales executive for Wellcare of California. I want to introduce myself to you and the community, along with a panel of dedicated women of color at the 21st annual KJLH Women's Health Expo. I'd like to introduce the panel, starting with Dr. Terry Retta. Dr. Retta is VP Medical Director for not only Wellcare of California, but the Centene Corporation line of business in the California market. Dr. Retta comes to the table with 25 years of experience in health, multiple lines of business in the community as far as health disparities, social determinants, and senior care. I'd like to also welcome to the panel Dr. Bambi Nickelberry. Again, another wonderful provider in our community that comes with a plethora of talents, musician, artist, mother, and a community advocate. I'd like to also welcome Linda Hart, founder and executive director and mother of a consumer for the African American Mental Health Coalition. Linda comes with 25 plus years of experience in community involvement, advocacy for the mental health community. Of course, Ms. Moselle Bostwick, dear to my heart. I've known her the longest, personally and professionally. Moselle is the director of marketing for Ultimate Medical Group, a very solid organization vested in the Black and Brown community in the Los Angeles market. And also Ms. Angeline Thomas. She is our wonderful, very, very vested in the community, millennial in the medical profession. She not only works for a very dynamic medical group, she also is an advocate that supports the providers that treat us in the community. Welcome, Angeline. And not only is she diverse, she is my sister. I've known her for a very short time, but it seems like we've known each other forever. Miss Shauna Lynch of Shauna Lynch Solution. Shauna brings to the table financial wisdom. She is also a coach professionally, spiritually. Shauna also is a broker in the insurance industry. And this is one of the most exciting times for Shauna as she branches out into the world, pulling all her talents to create a platform for our sisters and brothers in the Black and Brown community. Welcome, Shauna. You are a moderator for this panel today. I look forward to a dynamic, robust conversation. And again, welcome, ladies, to this wonderful event that KJLH has invited us to bring knowledge, compassion, and wisdom to our community. Shauna, take it away.
Thank you so much, Jill, for the fabulous introduction that you provided for all of us. I am really honored to be able to be amongst such talented women, women of color, that we'll be able to help empower our communities with this panel discussion today. So the topic for our discussion is the senior women's mental health and well-being during COVID-19. We have all actually been impacted with this pandemic professionally, personally, interpersonally, and this is now the time for us to all come together and speak on this and to enlighten people. So first off, thank you again. I just want to go around and just have a quick synopsis from the panel and asking them, Dale, I'm going to start off with you just really quickly. Tell us how COVID-19 has impacted you personally or professionally.
Thank you, Shauna. Very good question. During the pandemic, I've gone through several processes of the stages of grief. I've grieved the loss of family members that passed away, not from COVID, but during their passing, it was not being able to formally say goodbye. Grieving not being with my peers, not being in the community. And what I found out is even in my spiritual life and my faith-based life, I don't feel connected with the Zoom or streaming services. Again, it has been very hard to not be able to touch and feel and see. So again, I am at the point now where I feel like I'm addressing some of my issues, the restlessness, not being able to sleep at night, feeling isolated, even though I may be within a room of people, in the claustrophobia of the mask and not being able to breathe right. And then sometimes I feel guilty when I don't want to wear my mask and I know I have to because I'm gonna save a life. And it could be someone very dear to you or to my neighbor. So again, I'm on the other side. I feel very positive about getting knowledge around this topic and being able to see the light at the end of the tunnel.
Thank you so much for that, Dale. Thank you so much. And then we want to just touch upon and still have the same question being asked so you guys can see collectively how this has touched every professional. Okay, so I'm going to go next to Dr. Retta. Dr. Retta, can you tell us also how COVID-19 has impacted you personally or professionally?
Thank you, Shauna, and hello to all of the ladies on the panel. It is my privilege to be here today. COVID-19 has really had far-reaching impact to me professionally and personally. Professionally, I have been able to see some of the resilience of my team members. During this extended period of pandemic, we have really had to find ways to think out of the box to stay engaged. And I am proud to say that after having to really hustle to assemble and get everyone working from home quickly, we have been able to, with some degree of success, I can't say it was perfect, remain connected as a team and able to address the concerns of the associates that we work with while continuing to make sure that we meet the needs of our members. For me, professionally as a physician, not being clinically practicing right now really caused a bit of survivor's guilt at the beginning, especially when I saw the drain on the healthcare profession. And so to that, I have begun to kind of take some steps to reactivate clinically because again, I need to be at the bedside. I'm still proud to say that we are able to make changes from an administrative perspective, 10,000, 100,000 members at a time, making sure that the patients are able to weather this extended pandemic as well. Personally, along with Dale's comment, being separated from my family, not being able to really connect and be out and about has really taken its toll as well. But having this forum to discuss and really vent that has been therapeutic for me.
Thank you so much, Dr. Retta, for providing us with that feedback. Thank you so much. So going on to Dr. Bambi Nickelberry. Dr. Nickelberry, thank you so much for taking the time out from your busy practice right now and being able to be on this panel. So Dr. Nickelberry, same question applies. How has COVID-19 impacted you personally or professionally?
Thank you so much. And first of all, it's just really a blessing to be with these brilliant sisters here. It gives me goosebumps. But in terms of the professional impact, I could have never imagined this. I've been in practice for 41 years, which is also a blessing. But it just changed every aspect of my practice. I'm family practice, so I see people across the spectrum, even though the majority of my practice is probably seniors. So I'm really connected to these people. Some of my patients are like family. I have patients that I've been seeing for 40 years. And during this, I've literally lost entire families. So it's hard to manage. It's hard to watch. Spiritually, it's just really taxing. So I've just never seen anything like this. But it's amazing how they're starting to recover already. I'm just really impressed with how resilient my patients have been. Personally, it's been really tough. I take my practice very personally, so that's personal. But what I find is a lot of people haven't adjusted their level of expectation for doctors. Somehow they think we're immune to everything. They don't appreciate the fact that we can get COVID too. We can take it home to our family. So, that's a real struggle. And when you're on call 24/7, it's hard to separate personal from professional. So, I've lost families, and like the other lady said, it's a different kind of grieving because you don't get to say goodbye. You don't get to pay your final respects. So it's been really difficult. But I think one of the hardest things is people expecting me to be so much more emotionally, than anybody else. And doctors are going through the exact same thing. We're getting sick. I know 9 doctors who have died. That just broke me. It just broke me. So that's one thing I want people to understand. We're going through the same thing personally. We're losing family. We're grieving, and we're people that get COVID just like everybody else.
Yeah. Thank you so much for sharing that. And that's one of the reasons why I want everyone to see we are not in a box. We are all being impacted by COVID. And that's why I think it's important for people just to hear how it has impacted, you as a professional, you as a Black woman, you as a mom, you as a grandmother, you as a daughter. So we are all impacted. And I just want everyone to just know that. So with that, Miss Linda Hart, can you tell us how you have been impacted personally or professionally by COVID?
Well, first, I want to give honor to God, but I also want to thank you. And I'm so humbly thankful that I'm on a panel with such beautiful queens. For our agency, it impacted us because we are community outreach workers. So we basically deliver all of our services where they live or where they're at. And so we had to be creative and bring those services on a virtual model. So that has been a challenge, but we were still oftentimes out in the community, still not only providing information, but food. We would bring boxes of food out with us as well, especially for the seniors, because of the fact that many of them didn't have access to going to the grocery store. Personally, as being a grandmother, it was difficult. Of course, I missed one of my granddaughter's birthday party, so that was not a happy time. But as we move forward, I'm going to make up for that. I promised her we're going to Disneyland. So good luck on that one, huh? So personally, and as far as being a CEO of an organization, it was a challenging time because I had to balance both of those areas and be creative on how I was going to deliver services and the coping part of virtually speaking with my grandkids. So it was a difficult time, but times are changing. So we hope to be back out full time, back out in the streets.
Thank you so much for that, Linda. We appreciate it. And so we're moving on to Ms. Moselle Bostwick. So Moselle, can you please express to the panel and to the audience how COVID has impacted you as well, personally or professionally?
Yes, thank you, Shauna. And thank you for all the wonderful ladies that are part of the panel. It's great getting to know you all and, hearing your stories as well. So thank you for that. COVID has affected me both professionally as well as personally. And I'll start off by talking about professionally. Professionally, working for a medical provider, we were impacted immediately. And there were a lot of changes that needed to be made pretty quickly, as Linda said. And also Dr. Retta, is that we had to care for, how are we going to care for our patients? Also, how are we going to care for our employees? What does that look like? How do we do it? And so we deployed in our medical offices. We made sure everyone that could work from home did, and the IT did a great job in terms of making that happen. And for our patients, it was really switching to try to still provide care, but in a safe environment for them as well as for the employees. So lots of different changes were made to be able to connect with patients via phone and, eventually with telehealth. That was really a major undertaking. And for my staff personally, we're marketing, we're out in the field. So what do I do with my team? There was a lot of anxiety, I have to say, for myself as well as the team, because it's like, okay, you can't do your job now. Am I going to have a job? So many people were not, were losing their jobs. And so being a field-based team, you can't go out. What do you do? So we had to pivot, change what we were doing. We were doing outreach to our seniors. We were helping them move their specialty appointments and referrals and things like that. So, it was really a lot of changes that were happening both professionally, but also personally, because when we're also, for us being marketing, we were still, and I'm in the office today. I've been working a hybrid model, but we did make changes so that everyone in the office were spaced appropriately, wearing face masks. We take people's temperature every day, and that's still going on now. So doing everything as possible to continue the job that we were hired to do, but do it in a little bit different way. And then on a personal level, it's been very impactful. I feel blessed in one sense that no one in my immediate family or sphere has caught COVID or died from it. Unfortunately, I have employees whose, family members have passed away. I've had more than half the staff who've caught COVID, even with all those precautions. And a lot of it was, being brought from outside in, I have to say. And me personally, I'm a little bit claustrophobic, and the wearing of the mask gets to be a little tough. And so I need to be able to have a mask, but I've gone to different appointments during this time and have to take a break. And they're asking me, do you need some water? Do you need a break? And so I mean, all those things that were minor seem to become major. And I've really been practicing stress management and doing my calm to try to get through a lot of that. And one of the things that I feel is a really great blessing to me is that my mother-in-law didn't live, she passed away in September prior to the beginning of the pandemic because she was in a care facility and we wouldn't have been able to see her.
Yeah.
So that was a blessing that we didn't have to do it.
Thank you for that. Thank you so much for sharing those stories with us. Thank you. So Miss Angeline Thomas, Thank you so much for being on this panel as well and taking time out. And I just want to ask you the same question. How has COVID-19 impacted you personally or professionally?
Well, thank you so much for allowing me to be part of this wonderful panel and accompanying these wonderful ladies. COVID definitely impacted me both personally and professionally. Similar to Moselle, I'm part of the field reps that visit offices on a daily basis, conduct senior events in the community. So being pulled back and working remotely and learning all of these tech apps and seeing what was working, what was not, and the fear of, do we have a job at the end of this? What's going to happen was very difficult. It was scary. It was very scary for a lot of us. And on top of that, still attempting to connect with the providers like Dr. Nickelberry, seeing what they were dealing with, how many of those patients were passing, how many death certificates had to be filled out on a daily basis. Physicians were scared. They didn't want anyone in their offices. And as far as personally, not being able to hug, visit family, feeling scared and isolated was one of the big things that we had to face. Missing birthdays, having my grandparents in the hospital and not being able to accompany them. That was scary, having to call the hospital on a daily to see how their health is progressing. It was very difficult, missing graduations this past year as well, and seeing how many seniors were also affected because of those, my millennial peers at times still not complying with wearing the mask on a daily basis. So that was definitely difficult to deal with.
Yes, yeah, it's been very impacting for all of us. And so I'm grateful, I'm honored to be able to moderate and shed light, to people in our communities, providing them with the resources that you guys will be able to inform them of, as well as this is where we are, this is where we're heading, and what we're kind of seeing our vision. Because I think we're all pretty visionary here on this panel. And with you have to be, especially with your positions. So I'm also going to just give a quick how COVID has impacted me. So I'm a mother of two, both are in college. So everybody had to come back home. And that was, I was like, okay, I'm going to be an empty nester, but they all came back home. But the fear, as everyone has touched upon, when they're out, when my youngest was away, all the way on the East Coast, and I'm nervous, I'm afraid, we missed her graduation. So it's like, okay, now I have to do a quick fix so you still feel special around this time period. So it was a lot of peaks and a lot of valleys in my family. We've had deaths. My children's uncle passed away, who was actually one of my clients. So, being told by his wife, my husband's passed away, and then now I have to communicate this to my children. That is very hard. You can look at things from a spiritual perspective and say the blessings and the curse. The blessing is I've started and I launched my business. When the beginning lost my job, so then that whole stress and the anxiety and just, that's when you're like, Lord Jesus, take the wheel, right? Take the wheel. And so I can just honestly say that's how COVID has impacted me personally, professionally, but I'm also grateful that I have a village, and I consider you ladies, because we've all spoken during the pandemic, and you helped, so when you're in isolation, you have to reach out. When you feel like you're having a mental breakdown, which I'm sure we've all felt that, it's like, I have to go to my lifeline. I go to God, I go to my family, I go to my friends, my village. So with that, ladies, thank you. Thank you for letting me share my story. And we're just going to go ahead and dive into our day. Okay. So, Dr. Retta.
I'm still here.
Dr. Retta, we just want to find out from you, what processes did Wellcare implement to immediately help the senior membership?
Okay. That's a good question, Shauna. Thank you. So again, as part of really hustling to get the employees out and working from home, that in and of itself was really a major effort. And I do, along with Moselle, applaud the efforts of the IT team. Wellcare is a national health plan, and so there had to be state-to-state communication and connection with our corporate headquarters in Tampa, and then our parent, Centene, as well. So being able to get the employees out was first and foremost, but also not interrupting the business. And so there were three things that we did pretty quickly, I have to say, to make sure that we took care of our patients, our members. So Wellcare Health Plan in California is a Medicare Advantage plan. And so we primarily take care of seniors, those aged 65 years and up. So the three things that we did, we were fortunate in that Wellcare already offered a telehealth benefit. So whereas some others were standing up their programs, we just needed to ramp ours up. And we were able to do that through our vendor, MD Live, and we connected our nurse advice line as well, because a large number of the questions at that time were coming in related to COVID. So the nurse advice line was able to refer immediately over and warm transfer to MD Live when needed. So the telehealth vendor ramp up was one. Number two, we relaxed restrictions around prescriptions and authorizations and those type of things that would impede a member's access to care, because whereas their regular PCP may have been closed, if they needed to see a physician or a specialist, we needed to make sure that the members could still do that. So we relaxed restrictions around authorization and all of those things during the period of emergency, and around prescription refills for certain medications. We helped members get home delivery, because with the shelter in place, members were not able to get out and go to the pharmacy. Mm-hmm. And again, we had a very vulnerable population, being 65 years and up, right? And the third thing that we did, I organized efforts for member outreach. We organized different associates and divided up our entire membership. At that time, I believe we were at 40-something thousand members. And we reached out to each and every one. We started with the highest risk population, so those with comorbidities, those that might have had difficulty getting around, our homebound members, and we just gave a call. Are you okay? Do you need anything? And each associate had a list. If it was a food bank that they needed, if it was prescriptions, if it was this or connection to something else. And then we reiterated some of the benefits that we had that were available by mail, which included the over-the-counter benefit where they were able to get Tylenol, Band-Aids, denture cream, that kind of thing. And then extended services such as exercising with our vendor PeerFit, making sure that they were able to stay engaged while being really sheltered in place. Our goal was to really make them not feel shut in, even though they had to shelter in place. And we found that that was well received. People welcomed the phone call, the outreach, the relaxed restrictions, and definitely, we saw a large uptick in our telehealth, which we continue to this day. I do believe telehealth is here to stay. So those are some of the things that we did. And then of course, keeping our employees engaged with occasional events. You know, I don't know, just different things. Pictures of you at the prom or pictures of it, just things to keep the employees engaged and really keep their mind off of the panic of the pandemic, so that they were able to focus and take care of things for their own families, for themselves, and then for the members whose lives we take care of.
Thank you so much, Dr. Retta, for sharing that information, that Wellcare really made certain that they were all boots on the ground. It was a team effort and ensuring that the members, the senior market, the most vulnerable population, were going to be cared for. So thank you for that. Dr. Nickelberry, good morning, and
Good
thank you
morning,
so
Ms. Lynn.
much for being on this panel. So, Dr. Nickelberry, how has COVID affected your senior patients' mental health? And you touched upon it a little bit, but if you can just go a little bit deeper and let the panel know as well as the audience.
Right. Well, you know, they talk about COVID as, you know, the new COVID. And it truly is. We've never seen anything like this before. So the first thing was just not understanding what was going on, confusion. After that came fear. The part of that was the way it was rolled out in the media to the patients. It was a really fear-based presentation. And my patients were truly, truly fearful. And you combine that with not understanding what this invisible thing is, was really devastating emotionally to a lot of the patients. They looked at family members, friends, church members as somebody who could possibly give them something that could kill them. So everybody was suspect. And that's a hard place emotionally to be, long term. They were fearful coming into the office. That was at the beginning. Now, as it rolled out, these same members, either they started getting sick themselves. What they didn't understand is you can get COVID and live through it, but you don't hear that in the media. All you hear is, the 500,000 people who died from COVID. So there was actual panic that I tested positive for COVID. Am I going to die? How do I talk to my family about this? How do I keep from giving my family this? And then if a family member gets sick, did I do that? Did I kill grandma? It was really, fear and confusion were, I would say, the top two things. And as they started losing people, husbands, losing wives, and vice versa, these people have been together for half a century, maybe. Their surviving partner, as Dr. Retta mentioned earlier, went through this whole survivor's guilt, which was devastating. I can't tell you how many phone calls I've had with somebody on the other end crying. I'm not used to patients crying as I'm speaking to them on the phone. And sometimes they were inconsolable. So, there was that, and some of the issues Dr. Retta also mentioned affects their mental health. The more sick you are, the more susceptible you're going to be, to mental health issues. Patients weren't getting their medications like they should. They were scared to go to the pharmacy. They were scared to pick up the phone sometime and just ask the question. Yes. I'm out of my medication. I'm scared to go to the pharmacy. What can I do? Mm-hmm. So, what started off as a medical issue really turned into a mental health issue very quickly. And then they didn't know how to talk to you about it. Some of them, it was almost a shameful event, which they just couldn't articulate that. So as they got sicker, see, people forget we're talking about COVID, but all these people still have their ongoing medical problems. They still have high blood pressure. They still have diabetes. I lost a patient at home because, well, in this particular case, he died of tuberculosis. He had a little bleed. If he'd gone to the emergency room, he would have made it through. But he was scared to go to the emergency room. He stayed home. He bled out. He died.
Oh, no.
And I can tell that same story a dozen times over with other issues. You know, you check your sugar, it's 500. You know, usually that would bring them right to the office or right to the emergency room. They stayed home and slipped into a diabetic coma. I cannot remember the last time I admitted somebody for a diabetic coma. We just don't see that anymore. So they were actually scared to death is what happened. And then I don't know how to tactfully say this, but all of this conspiracy theory that you know went around this just made it worse. Just made it worse. They bought into it. So I tell them, turn off the television. The television, the media really contributed to some major mental health issues.
Thank you so much, Dr. Nickelberry, for sharing that about your patients, about what you had to endure. And that's the whole purpose. We want to be able to eliminate the shame and demystify mental health, and that making sure people are empowered with their mental well-being. So we're going to move on to Miss Linda Hart. So Linda, of course, I know with your organization, you are boots on the ground, you're consistently in the community. So has your organization seen a significant increase in the number of seniors being depressed? And how does your organization go about making certain resources are available to them?
Thank you for asking me that question. Another area that's not often talked about, but we've seen an increase, was suicidal ideology. So we were referring a lot of information to them around. There's 3 areas actually that when we're in the community that we provide. We provide presentations on mental health 101, trauma exposed, and suicide prevention. And we noticed that our suicide prevention program, that we were being requested to give a lot of presentations to families around that particular topic. So we did see a more increase for that particular topic than the other 2. The resources that we provide, we are connected with the Department of Behavioral Health and Public Health. So a lot of the information that we receive comes from their different departments and their counselors and their managers centered around those 3 areas. So we had plenty of resources. We had 1-800 numbers. With our network, we had networked with quite a few organizations, even individuals who were looking for jobs. We connected with Amazon. We connected with insurance companies. We connected with whatever the community needs were. We try to fill those gaps through our networking system. So it wasn't just us when we go out. We would bring vendors out with us. We even brought, a lot of people wanted to go back to school, even the seniors. And so we brought community colleges out with us to enroll them into the different programs and the different certificate programs, especially being able to allow them, you know, not to go through a whole process of years of education, but a particular skill. Gardening was also a #1 request. And so we reached out to Loma Linda. We reached out to the other universities that had a master gardener to come out and teach them to just do simple planting. So our resources was wide because of our connection over the years that we were able to build.
That's wonderful. That is wonderful. Thank you for that. Thank you for sharing. That's awesome. So what we're really trying to see and show everyone here today is basically you have in your house, okay, you have your medical groups, you have your health plans, you have your providers, you have your leadership teams that are within these different organizations, and then you have the additional resources. So we're showing collectively how we are all in the house to help you through your health, your well-being, somebody you can just talk to, cry on their shoulders. We are all here for you. Okay, so with that, we're going to take it over to Moselle Bostwick. So Moselle, how did your medical group address COVID-19? What did it look like at first, and how is it looking now?
Okay, thank you for that question, Shauna. Basically, Ultimate has always been on the front lines of providing care to the community. We are been in the medical industry now for 50 years, and our natural market that we take care of are basically the underserved communities within the LA and OC. So when COVID first happened, we stayed true to our mission, and we were on the front lines of helping to do the testing. We set up different testing sites in LA and OC. We engaged with our community partners as well as with the city and the state to stand up the locations to do the testing. And, you know, that was redeployment of a variety of different team members to be able to go out and do that testing. And one of my team members, Rosa, whom you know, Shauna, who was over our mobile unit. Well, mobile unit would go out and provide community-based testing. Since we aren't doing that, then she was basically working at a couple of our sites. And when we're talking about mental health, she did have because of just the fear that, not, let's say you go to work and you're not scared, but everybody else that you're coming in contact with has all that fear. And so that accumulates over time. And then there was somebody that waited a little too long. You know, Dr. Nickelberry came to the site, was tested positive for COVID, and they have to be taken to an ambulance from the site. So, you know, people, that kind of fear does impact those that are trying to provide the care as well. And it's not just, you know, it's everybody. It's the front desk person, it's the nurse, it's the doctor, it's, you know, our system overall. And so we were doing that for quite a long time. And then the cities and states stood up more of those types of locations. So we started doing more of the testing for our patients internally, and our patient call center was blown up. I mean, we've never, ever, ever gotten as many calls as we have gotten during that time. It was just nonstop. You know, people asking about COVID, asking about care, asking about, you know, everything. And so it took a village to get through it all. And the employees really did a great job in terms of, you know, some people spent months not doing their regular job. They were doing another job. That was the important job at that moment in time, to address the needs, concerns of our senior patients, of all of our patients during that time. And the other thing that we did is we continued to shift to provide the care that was needed and being asked for at that point in time. We did a lot in terms of social media. We have one of our physicians that's doing a lot of education around COVID and testing, and, you know, answering a lot of those kinds of questions. We also made sure that our employees, as I said earlier, that didn't have to be in the sites, could work from home. They were still doing their jobs from home to the extent that we could. And we also switched to doing phone appointments. We did a lot of outreach as well, working with our health plan partners. Everybody wanted to make sure that the most vulnerable, which were the seniors, A, we wanted them to make sure they were safe. B, we wanted to make sure that their healthcare issues were being addressed, not just COVID related, but other issues as well. And that if they had referrals or needed certain things, you think those could still be gotten, but it would need to be, you know, in a safe environment. So all of those kinds of things we were addressing as they came up. And via phone appointments, we implemented 2 video systems. One that was a part of our new electronic medical record, which is pretty cool, but you need a little bit of acumen as far as the electronics and smartphones, and a lot of our seniors aren't there. A lot of seniors have smartphones, but they don't know how really to use them so we wanted to make it simple. So we did implement a new system where it's just text message, where the doctor, they call, they don't even have to do it via the internet to get an appointment. They can always call Ultimate. We schedule the appointment, the doctor sends them a text, they click on the link, and there is the appointment. We also have been doing face-to-face, and now that things have changed, at one point in time during the midst of the pandemic, I would say probably 80% of our appointments were either telephonic or video. That is shifted now a whole lot, where if you go to our sites now, and also with our community-based IPA physicians as well, more people are seeing patients face-to-face, practicing all the social distancing, the taking of temperatures, all the COVID-related precautions are in place, but that is happening now. So we are slowly coming out of that pandemic cloud or funk, or however you want to say it, and to a better place in that regard. And people are seeking care, and they are getting the things that they need. And we have really, as we were outreaching to them, educating them about their benefits, asking them the questions, how can they get mental connected to either one of our social workers, or if they needed a mental health, if we provided it, then we would provide that to them. If it was through the health plan, getting them connected that way as well, making sure they knew what all the resources they have available to them so that they can make it through this safely as possible. And so we all get to the other side. And I think we're slowly getting to the other side. So those are the things that we really did, and also to extend that to our employees as well, because we can't provide good care if we don't have employees that are healthy, both physically, emotionally, and mentally as well. So that was really the focus that we had as an organization.
Okay, wonderful. Thank you so much, Moselle, for providing that perspective from Ultimate and how you were able to actually what it's looking like on the spectrum. So same question for you, Miss Angeline Thomas, pertaining to primary care associates. How has your organization addressed COVID, and what did it look like when you guys started, and what is it looking like now?
Thank you, Shauna. Well, at the beginning of COVID, a lot of our physicians were very scared. We all were. It was very difficult being out in the community and servicing our providers and having to work remotely, reaching out to the physicians via phone, attempting to schedule Zoom webinars with the physicians to keep them educated on what was going on, providing them resources on where to get tested, connecting with the offices that were actually performing tests, and making sure that we were connecting the dots with everyone and keeping them informed, because a lot of the physicians that we work with are independent practices and they needed a lot of guidance, and they reached out to the medical groups, especially the field reps that visit them on a weekly or monthly basis. So it was very difficult. And one of the big questions that we got at the beginning was, do you guys have any PPE for us? It was very limited. So when we were actually able to get our hands on some, we actually, we put the team together and we started delivering care kits to our physicians. I reached out to Dr. Nickelberry, who I've known for quite some time now, and I wanted to make sure that she was okay. Making sure that our doctors were safe, letting them know that we were still functioning if they needed any assistance to reach out to us. Our CEO is very involved, so he met with the physicians throughout the time being, making sure that if they needed any financial assistance, we were there for them. We wanted to be there for our patients, reaching out to them, having our member service team reaching out and coordinating appointments or rescheduling, making sure that we extend authorizations, reaching out to pharmacies to see if we can get mail order medication or 3 months supplies for our patients. So it was very difficult. We had to really transition and learn. A lot of the physicians were not seeing patients in person. It was, they had a note out on the door. Call, we'll do a telemedicine appointment. They had to learn because these are independent practices. We had to sometimes sponsor some of those telemedicine websites and such to make sure that they had the capability to perform for their patients. We had to educate them on how to bill. They weren't familiar with how to be compensated for certain items. So it definitely has shifted now with everyone being vaccinated and us moving towards the light at the end of the tunnel. A lot of the physicians are seeing a lot more in-person patients. Before you would walk in and all of the chairs were moved onto one side of the lobby because they didn't want anyone. You had to wait in your car. They didn't want anyone in their office. We've seen the plastic shields go up. We've seen the hand sanitizers, stationed everywhere, or doors wide open, so we didn't have to touch doorknobs. So it was very interesting and scary to see what was going on. It was a ghost town. Everyone was working remotely, being out and still visiting some of the providers, parking lots empty. You didn't see anyone. And of course, all of the seniors, they were scared to go out. So attempting to, reach out using our member services to reach out to the patients to make sure that they were still getting their care, because a lot of them were missing their appointments, were rescheduling, they were too scared to go out. So now that as the months have passed, we're seeing a lot of the offices starting to see a lot more of the patients in person. But I definitely think that telemedicine is here to stay, definitely.
Angeline, thank you so very much for wrapping up that first round of questions for us. We really appreciate that, and knowing that primary care associates really made certain that they were there for their members and their providers. So thank you for that. So going on to the next round of questions, ladies, and we're going to start with Dr. Retta. Dr. Retta, has Wellcare captured any data on how senior membership's mental health has been impacted? And I know it's kind of new, but if you just have any data that you could provide, that would be very helpful for the audience.
Thank you, Shauna. And that is another good question. As we continue to learn about the COVID pandemic and its impact on people, whatever the population is, for us seniors, but also our employees as well, data is still coming in. So COVID has been pretty dynamic the entire time. At our corporate office, our Wellcare corporate office in Tampa, and our parent company Centene in St. Louis, we are collecting data and going through it now. But again, there's a lag for quite a bit of it because we weren't asking for the authorizations or all of that. I can say that telehealth usage regarding just any behavioral health or psychologic component went up over 600%. Wow. So truly, we saw something there, which, to Angeline's point, telehealth is here to stay. So as the numbers continue to come out, we are looking at that and compiling kind of a lessons learned, if you will, so that if ever we are faced with this again, we will be prepared to respond promptly and be able to adapt to the needs of our members.
Thank you so much for that, Dr. Retta. 600%. That's wow. That is a wow. Thank you. And I'm glad that your organization, Wellcare, was very quick. That's what I'm hearing. It's like everybody was quick. We're just getting to the root to get to the solution, right? So this is amazing. So Dr. Nickelberry, in the African American community, there is a significant amount of fear surrounding this vaccine, right? So, and we know it's why it's historical, right? Because of experiments performed on Blacks. But what and how do you educate your patients to get over that fear, demystifying it?
The first thing I do is bring it up myself. You know, I'm unabashedly biased towards vaccines, and I'm convinced that that's the only way out of this for us. But again, it's the fear factor. It's they're listening to everybody and everything. They're listening to the news, which is misinformation, malinformation, and they really don't understand that this is the best science that since forever. You know, the development of this vaccine was nothing short of brilliant. Brilliant scientists that have dedicated their lives to developing this. The biggest myth out there is this is something that they rushed, that they just, you know, woke up one morning and decided to make this coronavirus vaccine. No, that is just not true. So I try to educate them on just how vaccines are developed and how that's not true. You know, we look at the flu vaccine. Every year it's a different vaccine. You know, they modify it according to what they expect the variant to be for that year, for that season. So we're always doing this. It's just that we're doing this for a particularly deadly virulent virus. That's the only difference. I'm sure Dr. Reda, she's shaking her head, she agrees. But you know, that's part of it. And you know, they have to put things like side effects in context. And when they watch the news, that's not done. This is a safe vaccine. And I think for them to hear it from their doctors saying, this is a safe vaccine. I took the vaccine. You know, I have no problems with it. But this is some of the best science that we've seen. Then the other problem is the history. Everybody's talking about the history and Tuskegee and other issues, and they don't even have the history right sometimes. The history itself has mutated over generations. So a lot of times I have to explain to them what Tuskegee really was. It was a terrible thing, but it's not what people think it was. So, you know, I just have to encourage him. We have a support system now. We have African-American doctors that they didn't have in Tuskegee. You know, we have heads of health plans. You know, we have the NIH, we have CDC that's either directed by or run by African-Americans. You know, we are everywhere in the science community right now. So, you know, you would hope that trust issue, would be increased. So I just try to demystify things with them. And I tell them, ask me anything you want and let me answer it. I've taken care of you for 125 years. Trust me.
Right.
And that really does seem to work. But it's just unfortunate that I'm battling the misinformation crew, and it's difficult. But I think we've been really successful once we make that contact. And I think it's important for us to raise the issue. Everybody that comes in, I ask them, have you been vaccinated yet? And I'm not above bribery. I'll tell them, when you get vaccinated, come back and here's what you get. And I have no problems with that. And the one thing they wanted their hugs back. They really wanted their hugs back. Well, once you get vaccinated, we can start hugging again. So, you know, I think demystifying and re-educating is the only way, and making it clear that this is our only option. For all of those people who are rejecting the vaccine, my first question to them is, okay, what do you have that's better? Do you have another idea? Do you have a better idea? I've never gotten a response to that, because this is our only way out right now.
Wonderful.
Dr. Nickelberry, if I could just piggyback on that a little bit, I know maybe a little bit, so Shauna, just
No, go right
you'll
ahead.
indulge me.
Go ahead.
And ladies
please.
on the panel, I will keep my comments very brief. It is very important that we have these types of forums to discuss the vaccine.
Mhm.
This is a big deal. COVID-19 is unprecedented in our community, and the effects of it are devastating. So to underscore Dr. Nickelberry's point about the vaccine and the creation of the vaccine, this was not a rush job.
It was not.
If you do your homework and look at the research involved in the creation of the vaccine, research work on the SARS virus, because viruses are studied all the time. Remember, this is SARS-CoV-2 that creates COVID-19, the disease, right? We call it today. So SARS research began way back in 2002 with the SARS outbreak, and then continued in 2012 with the Middle East Respiratory Syndrome outbreak, MERS. So just keeping that in mind, and some of the vaccines were being created for Ebola. So this is a vaccine that was already in the works well before we started talking about the words COVID-19. And what happened is, because the effects were so devastating, around the world, people were dying. Then you had these brilliant minds come together. Again, unprecedented, because competition was out the window, you know, this and that was out the window, and people wanted to come together to stop this thing. And that was the creation of the vaccine. In the studies, in the clinical trials of the vaccine, which all of the vaccines have gone through rigorous clinical trials, to get an emergency use authorization requires a lot of rigor. You cannot get by it. You cannot get by it. So they were rigorously studied. There were more participants that enrolled in the studies than ever before, and they were very diligent and careful to make sure that the participants in the study reflected the demographics of the country. So Blacks, Hispanics, Native Americans, people over the age of 55, people over the age of 65. So they were all studied to see the effects of the vaccine. So if that is one of the causes of vaccine hesitancy, please take the time during this Women's Health Expo to listen to the experts who talk about that, because that's one of the myths that really this panel here wants to demystify. I myself have been vaccinated, to go along with what Dr. Nickelberry said, and because the vaccine was going in my body, right?
Did your homework.
I always study and look it up, but there's a different level that you really try to achieve in your knowledge when you know you're the one that's getting the vaccine, right?
Exactly.
So I say that to the people listening to the recording, and to you know, make sure that we talk about that in our panel today.
Wonderful. Did you want to
I'd
add
like
something?
to add too, is this idea of vaccination is not new. You know, when we had polio, we don't, Dr. Retta, have you ever seen a case of polio? No, because we vaccinated polio off the face of the earth. We've been doing large-scale vaccination.
Smallpox,
you cannot go to public school,
measles,
at least in California, unless you've been vaccinated against measles, mumps, rubella, you know, polio, tetanus. This is nothing new. I think it's the, you know, it's much more deadly, but the idea of vaccinating ourselves out of a viral pandemic or epidemic is not new. We've done it several times before, and people forget that. When you travel, you have to get vaccines.
Yes.
You know, I spoke to my family members who were military. The most vaccinated people on the planet are your military. And they haven't had a problem. But somehow people take this when they take this vaccine out of context and make it the boogeyman.
Right.
And it's our only hope.
Well, you bring up a very good point, Dr. Nickelberry and Dr. Retta, because the conversation has to surround around demystifying certain components, right, in our mental health, demystifying the component around this vaccine, and having a platform, a consistent conversation on our health and our well-being, right? So that even leads to the question that I was actually going to queue up for Linda, and I'm sure you'll, I'm going to say you'll agree, but these kind of conversations, do you agree that these are conversations we need to continuously have post-COVID, and framing it around mental health for your community that you would agree with, Linda?
Yes, I would totally agree. Because definitely in the community, there is misinformation.
Mhm.
Remember in the beginning of the pandemic, we were hearing people were saying, oh, Black people don't get it. You remember when that came out in the community? So people were running around thinking because you were Black, you couldn't catch COVID, but then common sense kicked in because virus has no respect of race, age, or anything. So, common sense eventually kicked in. But again, the community, even much of what we're talking about today, don't have access to the accurate information that they need to know. So these conversations must continue so that we can dismiss all of the myth that the community currently have had that have been passed down from generation to generation. Again, it's a parable. My people perish for the lack of knowledge. So therefore, the only way that we can get out of this as well is to educate and to educate the community. I definitely agree.
Wonderful. Thank you so much. Thank you so much for that, Linda. Yeah, we need to break the curse, right? That is surrounding this vaccine. We want to see, all of our family members, and we need to have these conversations around the dinner table, at our churches, on the phone when we're speaking to our loved ones. I got vaccinated and I was like, well, I don't get the flu shot, okay? But I'm like, I'm going to get the vaccine because I want to go and hug Dr. Nickelberry.
I want to hug you back.
And I want to be able to not have a family be impacted how my family was impacted when we had a loved one pass away. So thank you again for that. Moselle, so right now, since we're coming, towards we're seeing the light at the end of the tunnel, right? So how are your offices approaching the reopening of business and provider practices now? How is that looking now for your organization?
As I said, we're starting to see more patients coming in. We're starting to see more of our IPA doctors opening their offices and seeing more people. It's more traffic, so I can tell that things are getting better. It's back to taking a longer time to get to work in the morning, so things are opening up. But with that, the focus on getting people vaccinated is really important to us. I was blessed to be a part of Ultimate, and we were part of the first wave of getting the vaccines. 1B, we were a part of that group, so we got it a while ago. And I was a little hesitant because I was like, okay, well, I really want this particular vaccine, but that's not the vaccine we got. So I was like, okay, do I wait till we get the one I want, or and I finally said, Moselle, listen to yourself, go get the vaccine. And so I did. And so, I'm very happy. My youngest daughter is getting her vaccine, or she should have gotten it today. So my entire family will be vaccinated. So that will be great. And Ultimate is really focused on educating the community, because the communities that we serve, the brown and Black communities, are the ones that are dying the most because from this virus. So we really need to get more vaccines into the arms of our community. So we're doing everything we can to do that. We had focused initially because of limitations on the vaccines, we just weren't getting enough. That we were focused on our employees and then our patients. And now we're opening that up to the community as well. So we have 2 sites in OC and we're doing them on a rotational basis right now in LA. And once the vaccines supply stabilizes, and we get the Johnson & Johnson back again to be able to do that, we're hoping we're going to see a lot more people that we will be able to get vaccinated. But the information to Linda and Dr. Nickerberry and Dr. Retta's point, the educational piece is incredibly, incredibly important to make sure that people buy into the fact that they need to get the vaccine to save their life and their loved ones and be able to get us all back to normal. And that it doesn't matter which one, we just need to get whatever one is offered, because that's where the sooner you get it, the better you're protected, and you're protecting other people as well. So those are, we have Dr. Shapiro, who is our vaccine champion. He's been out there everywhere, and we're doing weekly educational events via WebEx and Zoom and Facebook Live and some of those kinds of things as well. So, and he has offered whenever to go out and do these kinds of things. So as things are opening up, we're hoping to take the show on the road to as many people as we possibly can to continue the education, to make sure that not just the seniors, but the general community is getting vaccinated, particularly in our communities, which are are literally being the hardest hit right now. So that's really our goal right now, is to continue to be on the front lines of, just like we were for the testing. Now we have a solution. Let's make that solution available and everyone take advantage of it that really can. So that's kind of where we are. And we're working with our IPA doctors right now. Again, it's a vaccine supply. And a lot of, since the storage issues with Pfizer and Moderna or such, that a lot of the IPA community-based physicians don't have that capability. So we are partnering with them to have their patients come to where we have the supply, and we're doing the vaccinations. Hopefully, once we get the J&J, more of the community-based doctors like Dr. Nickelberry will be able to have that in office and be that immediate influencer for the patients who love and respect her, to be able to be the one that get them to say yes.
Wonderful.
Shauna, can I add
thank you. Yeah, go ahead, please.
And I think this needs to be triple underscored, what Moselle mentioned. When patients ask me what's the best vaccine, or no, I want to wait for J&J, or I want to wait for this one, you have to tell them, if you understand how mutant strains develop, the best vaccine is the first vaccine you can get your hands on.
Yes.
And that has to be underscored. The difference, the difference is minuscule.
Yes.
Get the first vaccine you can get. That's what's going to slow the mutation, which is going to be critical. And I don't think that message has really been put out there as strongly as I'd like to see it put out there.
Thank you so
agree
much for
with
adding
you wholeheartedly, Dr. Nickelberry, right there. I think that part of it, that immediate influence, Moselle, I really like you saying that. I know Shauna picked up on that and she will use that. I know it's a big deal for our PCPs to really advocate. It's one thing to get the message out. It's another thing for who is delivering the message.
Who's framing it.
And for our communities, people of color, women, moms, right, daughters, wives, we're really pivotal in that education and empowerment piece. So yes, it doesn't matter which one. And even I do believe at the time of this event, we're preparing now a little bit early ahead of the actual event date. So Johnson & Johnson is on pause right now, but it speaks to the deliberate care that these healthcare leaders are still taking. So every time you get on that registry and you say, okay, day one after your vaccine, how do you feel? Oh, my arm is sore, got a headache, whatever, right? They are monitoring that. So the minute there was a trend that looked like it wasn't something that was going the way that we were wanting it to, they pulled the vaccine back to do additional study immediately. Again, unprecedented. So that speaks to really the ongoing efforts that they have, because they want to ensure that whatever steps they can take to make sure that that doesn't happen, or if there's something they need to do in the preparation, administration, allocation, whatever it is, that they can do that and then reintroduce that. It doesn't take away any of the studying that was done before. And again, I want to make sure as a physician that you all understand that these things happen with everything. If you know anyone who has taken any kind of hormonal therapy, blood clots are one of the adverse effects of that as well. Anyone undergoing treatment for certain disease processes, same thing. So looking at the big picture, looking at the safety and efficacy of the vaccines overall, are they doing what we ask them to do? Yes, preventing death, decreasing hospitalization, allowing our babies to go back to school because they need to be together and be able to play, and really allowing us to be able to reconnect, right, with each other. Because like I joked with the panel in one of our discussions, the church choir sounds wonderful online, but not as good as it does in person. So we really want to be able to take care of what we all want, and that's that reconnection, right?
Thank you so much. Sorry, I don't know if you guys heard feedback. Thank you for that. Okay, thank you. Thank you so much for that, Dr. Retta, Dr. Nickelberry, Moselle. Thank you, because we do want to demystify, everything around this vaccine. So we appreciate your expertise on that. Going on to Angeline, we're just going to kind of piggyback off of what Moselle was saying, and how is your medical group, primary care associates, starting to do the reopening and approaching that?
Thank you, Shauna. Just like Moselle had previously said, we've been out in the front lines. We've seen a lot of this go on, and definitely providing resources to the physicians helps them open up. So whereas at the beginning, a lot of the offices had modified their hours, had to cut back on staff, a lot of them are readjusting their hours to work full-time. Definitely seeing a lot of more in-person appointments as well. A lot of the offices that I have visited, the staff, that the providers wanted to ensure that their staff was vaccinated before moving forward and truly opening up, and us providing them with the resources to get that. So at this moment, we're seeing a lot of more in person. A lot of the physicians that have been vaccinated, I myself being vaccinated, I can definitely see, whereas PCPs, them being able to vaccinate their own patients will definitely increase the amount of people wanting to get vaccinated by someone that they trust and they definitely admire. So right now, it seems like slowly but gradually, we're definitely moving in the right direction, and our offices are definitely more open to in-person contact, especially now that everyone's slowly getting vaccinated.
Thank you for that information about primary care associates, Angeline. Thank you. So ladies, we are, this is just amazing, and I'm just very excited. We are showing that we're the pillars in our workplaces, right, as women, pillars in our community, and pillars, of course, in our home. So you are all the griots. I'm gonna go on that term. We're the griots, and we do have an onus to make certain that we're letting people know, we're demystifying, we're having the conversations. So again, I just want to say, thank you all. And we're going to just keep trudging on through these questions and then going towards our wrap up. Okay. So this question is going to be posed for Dr. Retta. Now, does Wellcare have a plan in place, going forward to provide additional support for our senior populations, like after COVID, post-COVID?
Yeah. As we transition to what is hopefully a post-pandemic period, right? Yes, WellCare, along with HealthNet, California Health and Wellness, all of our combined California markets are really working together for that go forward, right? It's going to take a lot of time. While we had to hustle to get everybody working from home and get everybody set up, the undoing of that is really going to take some time. But we have a COVID-19 task force in our market that works in conjunction with our corporate COVID-19 vaccine task force, and then the ongoing COVID-19 task force in general, making sure that we continue telehealth, that we continue to outreach to our members and to our providers, our doctors, right? Making sure that they are aware of the resources that are available. So we will move from a period of a state of emergency into more of a new normalcy, right? Making sure now that patients are able to connect to their doctors in more than one way. So not just in person, but now with new and improved ways at telehealth, that they are able to take advantage of the benefits of the health plan in new and improved ways. You don't have to go to the gym. PeerFit will come to you at home. You can turn on the television, right? Making sure that we have adequacy in the health plan, because I do believe the aftermath will be ongoing for a long time. And the behavioral health, mental health piece is going to be of an immediate need for the long haul. There are a lot of repercussions. People are still dealing with grief and anger and death and just this long-term sequela. You'll hear Linda talk about short-term memory loss in probably about 2 minutes once I stop. And so the other piece is that the health plan now has had that reality check that it takes a village.
Yes.
We need to be connected with AltaMed. We need to be connected with primary care associates. We need to be connected with the African American Health Coalition, the pharmacy, making sure that we take care of the member in a 360-degree fashion, because you never know when something's going to happen to disrupt care the way we know it. So we can't keep having these gaps. So yes, the task force, utilization review, ongoing efforts looking at lessons learned. Those are the ways that Centene as a company, and then the California markets, HealthNet, California Health and Wellness, and Wellcare of California are working together to prepare for everything going forward.
Wonderful. Thank you so much, Dr. Retta. Thank you so much for that and explaining that, what your WellCare's plans are going forward. Thank you. I think we're having a little bit of technical difficulty with Dr. Nickelberry. The next question was going to be posed to her, but I'm going to jump and piggyback off of your question and go to Linda. Linda, so Dr. Retta kind of summed that up on what the task force is doing, what it's going to look like. As far as your organization that does focus primarily, I mean, you focus on a lot of areas, but the mental health component is one. What do you want from the health plans and the medical groups? How can they help your organization?
Basically, how they can help our organization is by giving us resources that we need to be able to give to the community members. because we also reach out to the homeless population. And we all know that the homeless population, they move around a lot. And so wherever we find them encamped, we go in and we provide information for them and to them. So by allowing us to have more access to resources and information will allow us to give them individuals in the community who are homeless, seniors, anyone who needs information, we will have access to that information. So again, information, education, and resources. And I'm sure all you beautiful queens have what we need. And so we just need to use the wraparound system. It takes a village. And so I look forward to continuing to work in collaboration with each and every one of you to do that.
Thank you so much for that, for your answer. Resources, education, wraparound, that's our word. We always do a wraparound. Just like you can't figure out the first process, wrap around. So thank you for that. Dr. Nickelberry looks like she hasn't been able to jump back in, but Dr. Retta, maybe this is a question that you can just piggyback on and help. So with the senior population, with demystifying mental health, right? What do you think are some ways that as parents, as grandchildren, how can we make our grandparents or those senior members in our family feel more comfortable to talk about their mental well-being, you know, and how COVID has impacted them when they go to their doctor?
Thank you, Shauna. I am in no way really able to fill Dr. Nickelberry's shoes, but I do believe in my heart that if she were here or able to get back in, she would say, we have to bring it up. We have to talk about it. I believe that she even said that once in this panel that we've been discussing today. Our primary care providers, those people that have an ongoing long-term relationship with the family, not just a patient, right? Like when she said, oh, I've taken care of you for 125 years. If you add it all up with the mom, the dad, the child, the grandmom, right? That would be the length of time that she's cared for some of her patients. And the PCP, or primary care doctor, primary care provider, is pivotal in that role. Seniors feel comfortable talking face to face. So first of all, being stuck at home and not able to talk to people or get there has been tremendously uncomfortable for them. So that has created isolation, loneliness, depression, anxiety, all of that needs to be undone. We need to peel back the layers of that onion right there. But communicating with them, making sure that the message is consistent across the healthcare delivery system as a whole is another way to do that. Being educated and empowered with the correct information is key, because we are combating a lot of misinformation and a lot of myths, right? About the vaccine, about the disease, about who's affected and who will be treated and relief, all of that. So coming together in this forum, and I do thank KJLH for having this forum. There's a reason why it's been going on for 20 years, why this is the 21st Women's Health Expo, right? We need to do this. And I remember in years past with the Expo, talking about it, getting it out there, letting people know that they are not alone in the questions that they have, in the feelings that they have, in the experiences that they have had. They're not alone. And by coming together, the village can heal, right? And each of us has a call to action. The women on this panel and the other panels that are involved in the Expo, to make sure that we do our due diligence to be that pillar in the community, to really take the time to study up and learn about these things so that when we come in contact with the misinformation or the myth, we're ready and able to handle it. Again, partnering is another thing, and really fostering that dyad relationship between the health plan and the provider to meet the needs of the member or the patient. that's the way we're going to be successful.
Thank you so much. I just want to segue. Thank you for that, Dr. Nickelberry, for that response. Dr. Nickelberry, I'm sorry, Dr. Retta. Dr. Nickelberry is actually trying to get back in. So I just want to put that out there. You guys can edit that out later, but Dr. Nickelberry is trying to get in, Cynthia.
Dale, you're on mute.
Okay.
There you go.
There she is. Okay, perfect. Okay, so let's go on with that question, Dr. Nickelberry. We're going to just piggyback on this question I had Dr. Retta answer for you. Okay. Can you hear me, Dr. Nickelberry?
I can.
Okay, wonderful. No worries, no worries. It's okay. So in your practice, you're working with your senior patients. We just wanted to know, like, how for us, like as the children, the grandchildren, convince our parents or our grandparents, the senior, patients, how can we convince them to talk about their mental well-being surrounding COVID with their provider? So we wanted to just ask you that. What would you want us to do to help you help your patients?
Wow. That's a tough one. I think you have to come at it head on. I don't think this is an issue that you can kind of lightly step around, and get support as quickly as possible when you identify a problem. And that's one of the things I think you all can help us with. You have to act quickly when you identify these problems. And sometimes it's as subtle as a patient saying, they're not going to walk in and say, I feel suicidal. That's not going to happen ever. They're going to walk in and say, well, doc, last night, when I fell asleep, I didn't really care if I woke up or not. That's a sign. That's a serious sign. So, we have to take those, but my challenge often is getting them the support they need quickly enough. Those kind of things, I don't think you can ignore for a day. And if you can facilitate, if you can help us facilitate things and speed them up, I think that would be great. Not all doctors can talk to patients about those kind of things with ease. So I think just, educating the physicians sometimes and expanding their skill set when it comes to, communication and empathy. And not everybody has the same bedside manner, with all due respect to my colleagues. And it takes more time to do that. You may need to spend 30 minutes with the patient to pull out all of that. What did that really mean? And to be able to explore it. So to be able to have somebody help me with that has that skill set. Not everybody is good at dealing with mental health problems. They don't have that skill set. So to be able to have a support team where we can refer our patients quickly to people who do, I think that that would be critical.
Can I interject on that piece quickly? Another question that comes to us when we're out in the community, oftentimes is, do they want someone that looks like them?
Yes.
And so that has also been a challenge. So finding providers, Black providers, Latino providers, for many of the community members have been a challenge, but recently they are gathering up a list of providers, or even our organization is taking up the challenge to put together a Black providers list, so that when we're in the community and they want someone that looks like them, we can refer them to different regions and different cities. So that has been a challenge as well, that the community has been coming to us with requests. Well, I want someone that looks like me because they'll understand my needs.
And the other thing, when you look in your provider manuals and such, there's no indication, who's African American, who's Hispanic. They may say somebody's Spanish speaking, but that's culturally, that's different. So if they had a better method of identifying who's African American, especially when it comes to mental health issues, they need to speak to somebody who understands their situation. Even I've had issues with, nutritional issues with COVID now. Everybody's eating differently and they're ordering food out, and it's a culture. It becomes a cultural issue too. So we've got to be able to talk to them about that. And I can't speak to my Vietnamese patients about their dietary needs as well as I can speak to my African American patients. It's basically the same thing.
Thank you for that, Linda and Dr. Nickelberry. That's true. You want to make sure you have someone that speaks the language of your heart, especially when it's something pertaining to your health, your well-being. It makes a difference. It makes a difference. So thank you. Going on to the next question, and this is going to be from Moselle. So you kind of touched upon it, but I want to hear it again with regards to your medical group offering on-site COVID vaccines. Yes or no, right? And if not, where do you direct them if you didn't have that? But I know that's a yes for you guys.
Yes, it is a yes. It's an affirmative yes, Shauna. We do offer the vaccines. We actually have given vaccine clinics with all three of the different types of vaccines. Right before the Johnson & Johnson one was put on pause, we had a vaccine clinic at our Southgate location. And that was the one that we really want to, succeed, because it'll be so much easier. It's one shot and done, and you can move on and be able to take care of more folks. We have a 800 number for our patients that we have been texting out to our patients. We've done a mailer to them. And we were doing this as the different categories were being laid out by the CDC in terms of who's eligible when. And so now that it's open to everyone, we've been texting and letting our patients know, those that we have good numbers for, know about the number that they can call. And we've been getting a lot of people calling us, and we're scheduling them through our pharmacy as well as at our various different sites. Our community providers that we contract with, they're able to direct their patients to Ultimed, and we are getting them their first vaccination as well as their second if two is required. And the other piece of that is the educational part as well. And one thing I did also want to mention is I agree with everyone who said telehealth is here to stay. It is really, really important, and it's an opportunity for people who are not feeling well to be able to be seen in the comfort of their home and still get the care that they need and they want. And it reduces the barrier, the fear, the anxiety, particularly when we were talking about COVID. But as we are turning the corner there, and as we move forward, it's going to be a convenience thing. And those that have it and it works well are going to thrive. And so, I just applaud Wellcare for all your efforts and being on the forefront of that and being a partner with Ultimate. The other thing that Dr. Retta mentioned is the collaboration, the wraparound. I agree with everyone that we are partners here, and we each have our expertise and resources. We need to inform each other of what that is, what the resources are, and be there to support one another and the patients that are ours particularly the senior patients who really need that support from a health perspective, from a mental health perspective, and also from a social and psychological perspective as well. We all have resources that we can tap into. Ultimate's been in the community for a very long time. We have been accumulating partners and resources, and we are deploying that in the effort to support the community, which have been so negatively impacted in so many different ways during the pandemic. And that's where the collaboration, has been great. And I just encourage it going forward. That's where we can be successful, and at the end of the day, provide the best possible care when and where needed.
Wonderful. Thank you so much for that, Moselle, and really good to know. It's a great information that your organization provides vaccines on site. That's wonderful. Angeline, same question. So is Primary Care Associates actually providing on-site COVID vaccines, yes or no? And if not, what are you doing to help navigate potential?
Thank you, Shauna, for the question. So at this moment, Primary Care Associates is not offering the COVID vaccine. A lot of our contracted physicians are independent practices. So we do have a handful that have been able to register in our vaccine sites. So we're working with them to get the word out. A lot of the independent practices are still waiting. Of course, they're waiting for the J&J vaccine as well. But for those offices that are actually offering, we're definitely looking to work with them. We've spoken to a lot of the pharmacies that we're connected with. We've reached out to a lot of the health plans and other health vendors that are able to begin putting sites together on behalf of us. For those that are looking for resources, we definitely, we guide them over to the LA County website to make sure that they've gotten vaccinated. I've helped some of my contracted physicians get registered and schedule their appointments, as well as staff, because at the beginning, the rollout, unfortunately, was very confusing. It was hard to get appointments. I myself could see myself at 12 a.m. in the middle of the night looking to see if I can find a slot, because I knew I was an essential worker. I was able to get vaccinated, and I wanted to. So it was very confusing. I had to flip between sites, between dates and time slots. So I think right now it's definitely a lot smoother than it was at the beginning of the rollout, but definitely guiding everyone towards the correct resources to ensure that they can go ahead and get vaccinated. So we're definitely working hard to make sure that we can assist the community in any way possible, and definitely working with our physicians like Dr. Nickelberry and with the health plans like Wellcare to ensuring that we can provide those resources, to our senior patients as well as the other populations.
Wonderful. Thank you so much for that information, and knowing that although your organization does not have it on site for your PCPs, you do navigate them towards the departments of social services or other community organizations that can facilitate. That's wonderful. So, ladies, we are now approaching our wrap-up questions. So again, I want to just thank you all for your beautiful, first, your beautiful faces. You guys just showed up and you showed out. And so this is amazing. So thank you for that. And we're just going to go into the questions, and this is open. Okay. So we want to just know, what is one truth or question you want people to know about the vaccine? Whoever wants to answer that.
It is safe.
Okay.
It is safe. There is nothing on this earth that's 100%.
Mm-hmm.
You're going to have some adverse reactions here and there, but you're not going to die from COVID.
Right.
And that's what I was going to say.
That's the very basic.
Your life.
Excuse me?
It will save your life.
Yes, yes, yes. And you may have a sore arm, you may have a little low-grade temp, but you will wake up the next morning
Yes.
and you will feel fine.
Probably to piggyback on that, I'm gonna cheat and give two. Uh, maybe not. Number one, the vaccine does not prevent you from getting COVID. You may still
Right.
be able to, so continue to wear your mask, your social distancing, even after vaccination, because we're still learning about this disease process. So stay vigilant, whether you're vaccinated or not, but the vaccine will save your life. I agree. And it is safe. I agree.
Yes,
There's
it
been
will.
tremendous research on the vaccine. So look at that. And to my people out there who are still kind of wrestling with the Tuskegee experiment regarding the vaccine, I heard something said by Dr. Reed Tuckson. Tuskegee was all about withholding a treatment that was known to cure. The people did not have access to get what was needed to stay well or get well. In honor of those people that gave their lives for that volunteered research, right? Then this is something that is available to everyone. We know this saves lives. So keep that in mind and really do yourself a favor. And again, honor those people from before by getting the vaccine.
Thank you, Dr. Retta. Thank you, Dr. Nickelberry. Does anyone else have one truth or question you want people to know about the vaccine? No? No? Okay, awesome.
Well, I just want to say that hospitalization has gone down quite significantly. So definitely it's keeping people out of the hospital and it's keeping people alive.
Right.
True. That is very true. And I feel in my heart, and just from seeing everything, we're all coming out on the other side of this. And I think we're coming out stronger and better and kinder. I really feel like this pandemic has it catalyzed us and to have a lot of fear, right? To have anxiety, to be stressed out, to gain weight. But now it's just making it full circle where you're seeing the humanity of people. We're having these conversations where we're reaching out, when we weren't doing this before because we just got so busy in our hustle and bustle. So there is a beauty outside of all of that nastiness, right? So,
and COVID, what I call COVID-15, which I see a lot of, I'm a victim of it myself, is curable. So
yeah,
have faith that we can treat COVID-15 now.
that's true. That's true. Or for me, COVID-20. So an additional wrap-up question, what roles does the health plan, medical group, providers, and behavioral health play in demystifying this mental health? You guys all spoke on it, but if somebody, just want to give one point, just so that we can just have that as a wrap-up.
I think that the health plan being kind of in the forefront of getting the knowledge or compiling the data, or, our duty is in educating our providers. And to that end, we are doing that. We are offering provider webinars to educate providers about being vaccination sites for that immediate influence that they have. We are continuing to outreach to our members, making sure that they are educated and empowered and connected to vaccine sites. I think that as people become increasingly eligible, so now in the state of California, as of April 15th, anyone 16 years of age or up is eligible for the COVID-19 vaccine. So there will be a clamor to get the vaccine. So it is our duty as the health plan to continue to match our members to the vaccination sites and help them get there. We provide transportation for those who do not have that. So all of the things that are necessary in the coordination of care and partnering and collaborating with providers is the health plan's responsibility in getting people to the COVID-19 vaccine and making sure they're understanding the decisions that they are making around the COVID-19 vaccine, and talking about the uncomfortable stuff that comes up, like the suspension of the vaccine and why it's important and what is the benefit of that. We don't want to shroud that in secrecy. We want to be transparent so that people don't lose confidence in the vaccine, right? This is a good thing that we've done looking at this trend. So making sure that the health plan kind of gets that information out there, keeps people up to date, making sure our providers are up to date.
From the mental health perspective, it's great to know that family and caregivers now have access to their medical health care plan when it comes to mental health. That's something years ago was unheard of. You rarely knew that there were plans centered around for individuals who were diagnosed. My son was diagnosed schizophrenia a couple years ago, several years ago, and knowing now that there is the ability for him to get treatment and therapy up under a healthcare plan was something in the beginning stages that I knew nothing about. So knowing now that many carriers are having a mental health component plan to their healthcare plan is awesome, especially for caregivers. And so I'm thankful for that. And letting others know that it exists. There are many individuals don't even know that their healthcare plan have such a plan.
And on the medical group side, that's what we do. We actually provide the actual care, and we are the ones that help the patients to understand their care and their side of it, what they need to do as well. They have a major piece of that in terms of their care. Ours is to make sure they understand what the resources are, connect them to care, provide the information that they need to be able to get the best outcome for themselves, and to meet them where they are, and to understand what their needs and what their goals are, and to work with them to achieve those particular goals.
Fabulous. Did anyone else have anything they wanted to add?
I just want to co-sign on something Roselle said. We need to learn how to meet them where they are. That'll solve a lot of issues for the both of us.
Angeline, did you want to add?
Yeah, definitely. You know, as the medical group, we have resources. You know, we have case managers, we have social workers. I myself working with the providers and insurance agents. Whenever there's a new patient coming on board, or they're looking to enroll a patient, let's say into Wellcare, I get questions from the insurance agents. Is this specific behavioral health specialist part of your network? So I do, you know, we're starting to see a lot of that come into play, you know, more recently since COVID. So to educate the providers as well as the members, letting them know that there are resources that can definitely help them, and definitely making sure that they're able to handle all of that care, and that the family is aware. I myself, I've seen my grandparents' health definitely decline, and their behavioral health definitely be affected. Their dementia get a little worse, you know, them being isolated. So definitely reaching out to the health plans, to their provider, and opening up that discussion to allow not only my grandparents to be educated, but myself as the granddaughter that is in the healthcare field, but is completely learning something new when it comes down to behavioral health. I think it definitely having PC, you know, the providers, the medical group, the insurance agents, the health plans involved definitely helps, because the patient's not alone. They have the resources here available to them. So I'm very thankful that I'm part of the healthcare system, and I'm able to reach out to health plan representatives as well as providers like Dr. Nickelberry to get resources on a personal level for my grandparents and family members that may be dealing with mental health issues that they don't know how to address.
Right.
Wonderful. Thank you so much for that. And thank you, ladies, for all of the wrap up questions. I'm just going to kind of close it because we've all touched upon it. I just want to say, from my perspective, now being on the side where I'm in the field, helping get your members to you, you know, and hearing the stories of, I haven't been outside in 6 months. I know I'm depressed, you know, and then me being their advocate, telling them to have those conversations with your children, have those conversations with your doctor. Here are, you know, let's go through your plan so that I can show you what you have to do. So we are all, it's kind of like a spider, you know, we're all putting out our limbs and our branches to make sure our members, the constituents in our community, have their mental health, their well-being consistent, because that's what it's all about, their continuity of their care throughout this whole spectrum. So just to wrap it up, we know we want to make certain that this vaccine is safe. So go get your COVID vaccine if you have not done it. Have the conversations with your doctor. Have the conversations with your children. If you feel something change in your mindset, talk. That's what we all have to do. We have to speak on this and just let it be known what the truths are and demystifying those things that can kill you.
The Radio Free 102.3 KJLH 21st Annual Women's Health Expo, brought to you virtually by the City of Long Beach and Fresno County Black Infant Health Program.